Okay, so let's talk about different practice areas and the breakdown of where you might find a pharmacist. In the United States, I would say between 50 to 60% staff, and that could include retail, outpatient, or in a hospital or some kind of facility. Then another 20 to 30% may pursue some clinical specialization, and let's say like the remaining 10% or like odds and ends. It could be pharmaceuticals, it could be academia, it becomes consultant work, business. It's up there. I'm kind of encouraging you guys when you're watching this to consider expanding at 10%, obviously, because I think pharmacists are capable of way more of providing such services, but their knowledge skills is kind of unrepresented, and that's where we're gonna go. So let's talk about like your, you know, a pharmacist that is working in a community setting. You may gloss over them. You may say, well, they sit behind the counter and count by fives, and that's what they do. Um, I I often think that the pharmacist is one of the most underutilized healthcare professionals out there, probably limited mainly by their technology and rules and regulations out there, because again, most people don't know what the training they have. I think community pharmacists present some interesting aspects that you may want to utilize, especially saying maybe I should bring in someone that works in the community setting to help me out here, because they have like the highest contact points with any patient. If you think about like how many times have you seen a doctor? Odds are, if you don't have any chronic conditions, you may see a physician or a nurse practitioner or a PA only as needed. So you may have your general health and wellness visit like once a year, maybe twice a year. And then when you get sick, you might reach out. You're using some kind of teleservice. But for most patients that have a pharmacist and filling the prescriptions, they're going to be going every time a change happens. They might be going every month or at least every 3 months to pick up a prescription, unless you engage in mail order or something like that. So there's multiple touch points for with a pharmacist. And most people, when you have a quick condition, will jump down to a pharmacy to buy something over the counter. So it's very much that pharmacists are highly present, but most people may not engage in those services because they don't know what they can ask them. But by and large, pharmacists do a lot of counseling out in the outpatient setting. They do immunizations. They have great interpersonal communication skills, I would argue. And the other thing is that they understand inventory. They understand how pharmacy operates. They understand the different laws. And that, to me, is one of the biggest areas that come up in terms of any digital health pharmacy startup-oriented place is, how does a pharmacy even run? What software do you have? Get this. I still get asked by people who assume that a pharmacist working in a Walgreens, CVS, or an independent has access to an EHR system database. And patients even think this, like, why can't you see the notes from my doctor? Why don't you see my labs? What do you mean you don't know my past medical history? Anytime you go to the pharmacy, think about how you initiated. You put down your name, your address, if you have any drug allergies, if you have any significant things maybe going on, if you can top of your head, and what medications you're on. So pharmacies don't run off of a EHR. We run off like a pharmacy management system that, how do we put in scripts? How do we bill? By God, pharmacists are really good with prior authorizations and understanding that and understanding billing. So that may be something that you want to look into. So they deal with it day in and day out. Anyway, back to the pharmacy management system, inventory and just like keeping everything organized and kind of like providing drug utilization reviews and such and medication interactions. But it's not going to be like, oh, this person should be on this and this. The pharmacist has to know it off the top of the head. I often argue a really good pharmacist can look at a medication profile and kind of an idea of what past medical history a patient has, because that's usually all we can do. So bottom line is, with community pharmacists and a lot of people who work and, let's say, do the grunt work for the profession, they have a lot of experiences. They have a lot of knowledge base. And I would say if you are looking to break into the pharmacy space with something and want to know how to work, you should really look at a community pharmacist, because you're going to have to adapt to the workflow. You're going to have to adapt to what is the realities of something in terms of working in that space. Because I've had some great ideas I've heard over the years, like, oh, like what if we gave pharmacists this data and they could do this and this and this? And it's kind of like, okay, first off, how would that work? Again, coming back to integration. So you have to go through a portal. How would it work in a workflow? Where would it bill and such? So these are questions you may come up with. And these are things I think that's honestly worthwhile discussing with people. And having a pharmacist that is working in a community and such that could be an advocate for you, as I mentioned before, 50 to 60% pharmacists, that, having someone that can serve as that for advocate, that can serve as a liaison, may help you better sell your product as well at the end of the day, because it can speak to the realities of their own experience working in the trenches. In any event, that also go for hospital. If you're targeting a hospital system, maybe a hospital staff pharmacist, you don't always need to go like, oh, I need the best clinical, I need the best manager and such, or someone who has a pure business. It's almost like whenever you ask for like an advisor or consultant who does not do any clinical practice at all to kind of give influence on that, it's kind of like, okay, they may in theory know all this stuff, but they may not know all the nuances of the everyday trials. I mean, I haven't worked in community, yeah, for a long time because I did mostly hospital stuff, and then I do home health care now. And before I was doing outpatient cardiology, so I would not want to just like be like the expert in community. By God, no, I'm not, because I don't deal with it on a day-to-day basis. I hear about it from other people, and that's why I would defer to them, because that may be the person you want to talk to. Again, if you're dealing with the highly clinical stuff, finding someone who has like you want to implement some kind of like care plan management for patients or something else like that, or you have an AI algorithm you want to implement that can follow guideline-based practice, or someone who just churn through data for you to find relevancy, maybe then you want someone more clinical mindseted that maybe has worked in the hospital as a clinical pharmacist. So that's the other next group you might hear. Clinical pharmacist is basically someone who's probably done a residency or has years of experience that works in a very clinical based setting and that aren't really doing the staffing role. They tend to be a smaller population. So I would say, let's see what else I want to add to this kind of like different work areas. There's a bunch of others, but if you have them, just put a comment. I'll expand upon it. But that's what I want to kind of talk about, like the differences between main practice areas of pharmacy.